from Louisiana's home team. This is Fox 8 Morning Edition at 6 a.m.
Many seniors face a few new realities they may sometimes ignore or dismiss as unimportant. And Dr. Neil Baum with Peoples Health joins us now with how certain cases can lead to serious problems and serious social issues and why you should take them seriously. Good morning.
Good morning.
Thanks for coming in. Let's start with your eyes. You know, as you age, there are issues with this. Let's talk about the problems seniors face with eye loss and why they should take them seriously.
About 1 in 3 seniors over the age of 65 are going to experience either problems with cataract, glaucoma, macular degeneration, or the complications of diabetes. For that reason, seniors need to see an eye doctor at least once every 2 to 3 years and make sure that their glasses have the right prescriptions. Those things are all preventable and can cause blindness if neglected. Now,
also, I mean, there are certain signs and things that you'll notice that's happening to you. What are those things, you know, you should look for as you age to know that, you know, I'm in that age range now, or maybe I should get it checked?
You have blurred vision, you have things floating in front of you, you have difficulty seeing your iPad or your iPhone, you have trouble reading the phone book. These are all signs that there is deterioration in your eyesight, and importantly, it can affect your safety because of driving.
Right, and a lot of times it's tough for seniors because that's their independence, you know, to be able to drive. So, you know, if they don't do it, what do you do in a situation like that? Do you alert the DMV? I mean, what do you do?
Absolutely. It's the law that you do have to alert the DMV that you are having problems, has to be changed on your license, and you can get it corrected.
Is that something a relative should do, or?
The relative or even the doctor may have to do it. But it must be done because it's not only the safety of the driver, but the safety of the community as well.
Right. Okay, and let's talk about memory. A lot of times, you know, people say, oh, it's just a little, I just sometimes forget things, but how do you know when it's serious? What are the signs, and then what do you do?
Well, it's not just remembering telephone numbers or names. That happens to all of us. But what really becomes problematic is where you forget who you are, where you are, you become disoriented, you forget normal hygiene like taking a shower or brushing your teeth. When it impacts your lifestyle, then it becomes dementia, and then that needs to come to the attention of physicians. But there are things that can be done to prevent all of those things, and that is daily exercise, proper diet and nutrition, stay active, stay social, and engage your mind.
Yeah, because it's like if you don't use it, you'll lose it. You got to keep reading, keep talking, keep engaging.
It's like a muscle. You know, if you fail to use the muscle, it shrinks and becomes less effective. So the mind has to be exercised by some of those suggestions I just made.
Right. And lastly, it's tough for many people to talk about as you get older. You know, all of a sudden you're losing control of your body. Let's talk about incontinence, what it is, and how to deal with that, because it's such a sensitive topic.
Incontinence is the involuntary loss of urine. It affects women twice as commonly as men. It is usually due to menopause, childbirth, but there are other conditions that can also make women at risk, such as obesity and diabetes. And help is available. They can do exercises. There are medications that are available. There are dietary things that are bladder irritants that they can avoid. And in certain situations, they can have surgery. They don't have to depend on Depends.
Okay, that's a good way of getting that key piece of information out. Bottom line, what I'm getting from you is like, check on these things. Don't just ignore them.
Yeah, we can't stop the clock, but we can grow and glow as we get older if we have good health.
Grow and glow. I love that, Dr. Baum. Thank you so much for coming in.
Thank you.
Some really good information this morning. Appreciate it.